Hello viewers, in this edition I'm going to talk about epilepsy, which is a very broad disease. It's not one disease. There are very many types of epilepsy that we have, and they need accurate diagnosis and treatment to avert any increased morbidity or even mortality for some of the cases. So the definition of epilepsy is a neurological condition, which means it's a problem that originates from the brain. It's a disease whereby there is a lot of increased excitation in the brain, a lot of firing in the neurons in the brain that now manifests itself as something we call a convulsion, where somebody has some movements of the hands and legs, rolling of the eyes, and also can have some foaming in the mouth. In this case, we call that a generalized tonic-clonic seizure, and it can also have very many types, as I had said earlier, types like absent seizures and many other types that are beyond the scope of this topic. The main thing that I want to bring forth is that this disease manifests itself, and it has to be reported to the hospital so that various tests can be done and the appropriate treatment is instituted. There are very many tests that can be done, but the main tests are two. One of the tests is a test called an EEG, an electroencephalogram, which just means we are testing to see if there are any excess excitation in the neurons in the brain to tell us that there is actually increased activity in the brain that will tell us that we have seizure activity. Then the next test is an imaging test. We can do something called a CT scan, and we can also do something called an MRI. The main aim of these imaging modalities is to tell us if there is something structural in the brain that is causing the excess excitation of the neurons. There are very many causes of epilepsy, ranging from genetic abnormalities to brain tumors and some other groups that we call idiopathic. There are no specific cause. So the main aim is to make sure that we don't have an alarming cause so that we can have institution of the necessary treatment, and there are good outcomes. With accurate diagnosis and treatment, there are very good outcomes in epilepsy. Once a diagnosis of epilepsy has been made, the client needs follow-up, preferably by a specialist, because there are treatments that we give to control that excess excitation of the neurons in the brain. These medications are taken over a long time, and we need the client to be followed up so that we ensure that they are seizure-free for a specific period of time, depending on the type of the seizure, so that they'll be free of the seizure before the medications are stopped. You are not advised to stop the medications abruptly, and just following the patient over time really helps, and we should advise all our clients and our family members or people we know with epilepsy that they can get accurate treatment and their life will be okay even if they have epilepsy, and also to avoid alternative treatments that have not been proven to treat epilepsy. There are only medical treatments that have been proven to treat epilepsy, not any other alternative treatments. So there is hope for people living with epilepsy. That is why we call them people living with epilepsy, not epileptics. Yes. Thank you for watching this episode on epilepsy. I want to advise all of us to share this video widely and ensure you subscribe to my channel, and thank you so much.